For today's conversation, I would like to cover the top 3 procedures. In fact, in an earlier video you made this year, you predicted 3 trends you might see in 2024, and I'm curious if they're still the case. First one is liposuction. Second one is breast augmentation with the fat or with implants. And the third one is tummy tucks, not just for moms, but traditionally we see with moms. How's that prediction been so far?
It's pretty spot on. Liposuction is as popular as ever. There's a technology called Vaser technology. It's a liposuction with an ultrasound probe that helps us define and shape thinner people as well as trimming up heavier people. So liposuction is definitely on top of that. Tummy tucks are right there behind it. Most every tummy tuck I do involves using liposuction. You know, a tummy tuck is at least 3 or 4 things, one of which is removing skin and fat, one of which is, liposuctioning the waist, and 3 is actually tightening the tummy muscles that have been stretched or pulled from pregnancy. And as far as breast augmentation, still as popular as ever, at least in our area. I think nationwide, smaller implants are definitely more popular than they have been, and certainly natural, fat grafting of breast. I've done much more of that this summer than I thought I might. And again, it lends itself toward shaping and contouring someone's waist and legs, and then using that fat to add some volume to their breast.
Yeah, absolutely. And when it comes to those 3 specific types of procedures, I'd love to kind of land the plane here for a moment and kind of chat with these over some popular questions. Would that be all right?
Sure, absolutely.
Yeah. When thinking about liposuctions, many people just think about the tummies first, but you shared that this is no longer the only use for them, and there are multiple variations of this procedure. Can you share more about this statement, and what are the main differences between traditional liposuction and techniques like tumescent, ultrasound assisted, and of course the laser assisted liposuction?
Right. Well, I mean, liposuction has been around for quite some time, and again, it continues to evolve, not only in the results but also in the recovery phase. And the sites that can be liposuction are literally from head to toe. The jaw can be liposuction, the neck, under the chin, the arms, the back, all the way to people's ankles. There's no limit to where we liposuction. There's a phrase called liposuction 360, which is a popular social media phrase, which probably doesn't quite do the term, doesn't do the specialty justice. It's really circumferential liposuction, where we would lipose someone from their breast down to their pubic area and from their armpits down to their buttock, on the backside.
Sure. So like a particular region of area.
Right. Well, and again, circumferential around the entire trunk. In general, the closer someone is to their ideal weight and the more areas you liposuction, the better the results are going to be.
Sure.
And then there's that other side of liposuction is once you harvest the fat or remove the fat, can you do something extra with it?
Right.
And that's where fat grafting the face, fat grafting the breast, fat grafting the buttocks comes in.
Right, because you have the ability to reutilize those parts elsewhere.
100%.
I'm curious, how do you determine which type of liposuction is best suited for a particular patient?
Well, in general, this Vaser technology liposuction is the best on the market. And for me, I've used it almost a year now, and it certainly provides me with better results. Not only the actual result, but there's less pain, less bruising, and a wider range of age and body types I can treat with it.
Oh, very fascinating, especially when you consider just the range of potential that you can do. Does liposuction help with cellulite or those areas that just aren't responding to, traditional diet and exercise?
So cellulite is a very common occurrence. At least 80% of all women will get cellulite, which is simply just cords pulling the skin down between the subcutaneous fat and the skin. Mm-hmm. Liposuction can treat those. Nothing treats them 100%. But if somebody is troubled by liposuction, let's say on their buttock or their thigh, at the time, if someone is troubled by cellulite on their buttock or their thighs, at the time of liposuction, I will literally take a small needle or a small knife and clip each of those cords, and then liposuction after that.
Oh, wow.
And in the buttock, we can release those cords and place fat or there's a product named Renuva. It's a human product that does not have any antigens, doesn't have any negative things in it, that actually stimulates fat growth. So we've been treating a lot of patients who don't want more volume in their buttock. They may want their hip dips a little bit smaller. They want their cellulite lessened, and releasing those cords using this product off the shelf that's called Renuva has been a great way to do that.
Dr. Denk coming out with some rapid fire workarounds for something that traditionally people just, might just settle for, and a lot of times, but it sounds like there's some opportunity.
Well, I mean, there's no doubt. I mean, plastic surgeons are out to serve their clientele, and it's the patients who, they're the one who push us.
Right. And that's what you want for your industry too. You want to be challenged and really, in a safe and ethical way, really figure out exactly how to mitigate those risks and also make the results happen. Right?
No question. People, I started out doing reconstructive surgery, first doing children, then doing breast reconstruction. And a lot of physicians, and I think public, say, well, cosmetic surgery, that's easy. Anybody can do that. It's actually just as difficult or challenging or even more challenging than reconstructive surgery, because the patient's expectations are so high that managing their expectations, meeting their expectations, it's a worthy challenge, and something anybody who does primarily cosmetic surgery takes seriously and enjoys it.
Sure. And speaking of expectations, the next one I want to dive into is breast augmentation, which of course has lots of, conversations and, things that we'll dive into later as far as the stigma goes. But I understand with the, in terms of the augmentation process, clients can achieve, various outcomes based upon their preferences. As you mentioned before, really pushing those boundary lines. What options do you offer for your clients to choose from when it comes to the breast augmentation?
So, breast surgery is a whole book, right? There are patients who solely would like just a breast lift without any augmentation, without any enhancement. If somebody wants to increase their size, there's essentially 3 or 4 options. Option 1 is using their own fat, if they have some on their waistline or on their thighs. Number 2 is using an implant. The breast implants worldwide have about a 95% satisfactory rate with patients. There are silicone gel implants and saline implants, and there's benefits to either. And then there's the occasional patient who may want an implant with a little bit of fat on top. If there's not enough breast tissue to hide the implant, it's nice to put a little icing on the cake with fat, say primarily in the cleavage area.
Sure.
So those are really 3 techniques: fat alone, saline or silicone implants, or an implant with some fat as well.
How is 3D printing currently being utilized in plastic surgery?
Well, we don't use it. Certainly, you have to be a little bit of an artist, I suppose, to be a plastic surgeon. But it's really about conveying expected results to patient.
Sure.
Some people use 3D imaging all the time. There are plastic surgeons that do it. For me, I've always said to patients, if I can't have a conversation with them and explain to them what they're going to look like, it's a failure on my communication.
Sure.
On the other side of things, if I print out a 3D image of what they're going to look like, well, then that's exactly what they expect to look like. And sometimes, that raises expectations to a point that's unrealistic.
Yeah. What are the common incision techniques for the implant placement, and how do they affect scarring and recovery post procedure?
So again, Joe, it all depends on how much loose or excess skin someone has.
Okay.
Ideally, if someone is just smaller breasted and they do not have any loose skin, an incision typically 1.5 inches or so below their breast in the inframammary crease, in that area below the breast as the breast meets the tummy. 1 incision there, 4 centimeters, 1.5 inches, 2 inches at the most. And that incision will not change the function of the nipple. It will not change the function of breastfeeding. We don't go through breast tissue. And when a patient looks at herself in the mirror or looks down, you can't see that incision.
Sure.
That is definitely the primary incision. If someone has excessive skin despite putting an implant in, then we need to tackle that problem and to tighten skin. And typically, the incision is made around the areola. A lot of women have more generous areolas than they want after childbirth. So taking some skin and hiding the scar around the areola is a typical thing to do as well.
Are there any myths about breast augmentation that you want to set the record straight on?
I mean, the biggest thing is that plastic surgeons, I think for years, have recommended certain sizes to patients. The way I practice medicine, I want it's about what the patient wants.
Right.
I equate it to shopping, and truly the best thing about a breast augmentation or breast surgery in general, if a patient can think of it, I probably have done it and I can do it again. And the size is totally up to the patient. Now, there are patients that I'll talk down in size, and there are patients I talk up. I just refused to do a young patient who traveled quite a ways to see me because the size implant she wanted was really not a good choice for her at her age.
Sure.
So, for me, I think the number one myth is that, plastic surgeons just take it out of the cupboard and put in the biggest implant they can.
Right.
Those days are long over. Women want manageable, perky, maybe even fun breasts. Most people don't want to be a breast. They just want nice breasts.
Yeah.
Hey everyone, Michael here from Behind the Camera. Right now we're taking a quick break to acknowledge and thank our wonderful studio host, Atlantic Bay Mortgage Group. When it comes to getting information and guidance on financing your next home purchase, we recommend talking with Atlantic Bay. They are one of the original lending institutions in our home city of Virginia Beach, and have a long resume of getting the job done well and making your home buying experience more enjoyable. So, if you're looking to experience Virginia full-time, consider checking them out today at www.atlanticbay.com. Disclosure: loan programs may change at any time with or without notice. Information deemed reliable but not guaranteed. All loans subject to income verification, credit approval, and property appraisal. Not a commitment to lend. Atlantic Bay Mortgage Group, LLC, NMLS number 72043, NMLSconsumeraccess.org is an equal housing lender. And now, back to today's show.
Now, your services also cover, for a specific clientele. It's not exclusive to this one, but, it's most definitely more popular in the area for moms, and that's going to be tummy tucks. What specific benefit does tummy tuck offer to postpartum women?
So most postpartum women are troubled by this stubborn lower abdominal fullness, bulge. Some of that is related to the rectus muscle stretching longer than they were and also stretching wide. Mm-hmm. And again, that's the functional part of a tummy tuck as well. Muscles that are stretched out and separated. A separated abdominal muscle is called the diastasis recti. But in general terms, the muscles are just too long. So shortening those muscles not only lets them wear a pair of jeans or a tight skirt, it also helps with posture. It helps with bloating. It may help with bowel function. So a tummy tuck can be a functional operation. It also changes the contour, obviously, of their waist, lower back, and lower tummy. It lets, not to be too forward, but I mean, there's a lot of young gals who are in their 20s, 30s, and early 40s. Their goal of a tummy tuck is to get into a pair of tight jeans or even a two-piece bathing suit,
Sure.
which I certainly
Your
share
goal
with
is to
them.
help enable the patient, right?
Absolutely.
Yeah.
Hidden scar, great looking belly button, flat tummy, and in their words, a tight waist.
Yeah. Can you combine a tummy tuck with other procedures such as breast surgery for more comprehensive, I'll use the term, quote, mommy makeover?
Absolutely. No, mommy makeover Yeah, I think is a great word. I know some of the guys in New York City are not keen on that terminology, but again, what organs are affected by motherhood the most?
Yeah, absolutely.
Tummy and breast. So I think a mommy makeover is quite fitting. I do a lot of that at the same time. The recovery is pretty quick. It's certainly less expensive for somebody to go through breast and tummy at the same time. And with a mommy makeover, it's simply an operation on your tummy, an operation on your breast. The operation on a woman's breast may just be a breast lift, Joe. And certainly on a tummy tuck, I may liposuction someone's entire back and their waist and do a tummy tuck as well.
Wow.
So a lot can be. There's a lot of
Yeah.
options, and there's no cookie cutter mommy makeover. It's really what the patient wants and what her anatomy
Sure.
what her anatomy brings and what her expectations are.
And I think that question is popular for a lot of reasons too. In addition to the term, is like, how much can you do at one time on your body before it is too much, right? And that kind of leads me into my next question. What advice do you have for women considering, getting a tummy tuck to ensure they achieve their best results, whether they're having the traditional just tummy tuck or doing the mommy makeover and wanting to still be able to have a more quick turnaround time?
Well, one of the best things about social media, now I'm sure you know this yourself, for a plastic surgeon, my Instagram accounts are a catalog of what I can do.
Right.
So there are before and afters on there. And for somebody to go and find, and this is what my patients tell me, I try to find somebody who looks like me before and somebody who looks like me after. And there are, hundreds of patients of mine in the last 2-3 years who have followed me for a year or two before they even come to see me.
Sure.
So
yeah.
My advice to women is, be comfortable of who's going to do your surgery. Social media gives you a great way to try things on with someone. You certainly can get to know a plastic surgeon with a virtual consultation. And I would go with your feeling, with your gut, that you're comfortable with your plastic surgeon, and see 2 or 3 or 4 until you are.
Right, absolutely. And you have an extensive catalog of the work that you've done. And as you mentioned before, just give patients that extra boost of comfortability and also just the experience of what you've done so far.
And for a patient to be comfortable, gosh, take your mother, take your husband, take your girlfriend to the consultation, because they will only help you foster that relationship more.
Absolutely. Absolutely. Just the goal to empower these individuals and to find out exactly what it is they're looking for.
Well, and life's about relationships, Joe, and the relationship you have with your plastic surgeon and I have with my patients is precious to me. It's invaluable.
Absolutely. And in the community you've built overall, that's kind of where we're going to have our next conversation. The community is important in fostering that credible information and breaking a lot of stigmas out there, because there are stigmas around plastic surgery. And I want to open up that dialogue here for a moment to get your take. Would that be all right?
Sure.
So there's a big concern around health and safety of our bodies. What health risks exist when undergoing any form of plastic surgery, or some people might refer to as body modification? And how do you, as an experienced, I highlight the word experienced here, board certified plastic surgeon, really go out about mitigating those risks?
Well, I think the number one risk is general anesthesia. Once a woman says, "Oh yeah, I definitely, Dr. Denk, I want to go with a tummy tuck, I want to go with you," the next thing they ask is, "Tell me about anesthesia. What are the risks of anesthesia?"
Right.
We use physician anesthesiologists only in our office. The nice thing about my office operating room is I get to pick the anesthesiologist. I get to choose the staff who works the operating room. It also so happens to be across the street from the Virginia Beach General, just in case. So, the safety of the OR is important. And what I typically say to patients is, if I take the typical 35 to 55-year-old woman who takes no medication, or maybe takes a mood elevator,
right,
that patient has about a 1 in 300,000 risk of having a catastrophic event. A patient, or myself, or you, Joe, today has about a 1 in, 5 to, a 1 in 60,000 risk of getting in a car accident. So the risk of general anesthesia really is about a fifth the risk of driving a car.
Right.
So in general, it's very safe. But again, making sure the patient's medical condition is excellent. If not, I have them see their family doctor or their internist beforehand. So safety first, safety
Absolutely. And that's the beauty of the Virginia Beach, Norfolk area. We're not in any short supply of certified, well-equipped and well-versed, medical professionals for sure.
No, we're fortunate that way for sure.
So when it comes to the peer review side, I want to highlight this next for you and kind of dig into this statement. So there's an excerpt, and I'd like to get your opinion on it. It's from the Journal of the American Society of Plastic Surgeons, in reference to stigmatization of the field. Perhaps the first step is to admit its existence. There is some resistance to accept this view in academic circles, and one possible factor is plastic surgeons are somewhat reluctant to admit that their work may be controversial or stigmatized to begin with. Individuals who choose to undergo these procedures often find themselves condensed to or shamed, and even accused of having psychological problems, which in turn influence them to hide or deny that they had undergone, quote, the knife. Many celebrities, considered cultural icons or, features of natural beauty, are outed years later in their career in, demeaning and salacious manners by the media as if the surgery is a shameful secret in their past. This part I really am curious about, Dr. Denk, from your perspective.
Right.
Beauty is not skin deep, and cosmetic surgery is not superficial in terms of its impact on patients' lives. It often addresses psychological issues that are deeper and more complex than just pure aesthetics. Evidence has shown that patients who undergo these procedures enjoy benefits such as improved sex lives, self-confidence, and self-image. I know I threw a lot at you, Dr. Denk.
You did.
I want to kind of summarize here. There's a big push when it comes to the importance of processing this body transformation. When it comes to that general process, what are some of the conversations or possibly the context you have with, patients before they undergo the procedure, just to be mindful and aware of when it comes to addressing that stigma?
Well, it's a big topic, Joe, and I'll take it, a little bit at a time.
Absolutely.
In a consultation with a patient, the first thing I do is to ask them what would they like change the most. If they had one thing to change, what would it be? And some people have a very hard time with that. They want to tell me 6 things, but I always make a patient come up with a priority list, and we go through 1 through 5, 1 through 4, whatever their list is.
Right.
Now, I may only get through the first 2 with the first operation, but, listening to them. And I think that the thing that I think the whole world needs to realize is that plastic surgery is only for the patient. And we live at a time when there's a lot of envy, and people want to know why does she look so good? Why does he look so good? What did he have done? I mean, it's 20 years ago, gosh, 80% of patients didn't want to tell anybody. I find that today, at least 50 to 60% of patients are happy to share what they've had done. Mm-hmm. Now, I don't operate on any celebrities,
sure,
for better or
for worse. That you're allowed to disclose.
Yeah, for better or for worse. Yeah. But again, plastic surgery is for no one but the patient. And certainly I've been in a situation where patients' families, friends, and otherwise have tried to talk them out of plastic surgery. But I think we live at a time where, number one, plastic surgery results are getting more and more natural, and there's a lot of guesswork to know if somebody's had something done.
Right.
And the better we get technically, the harder it's going to be to tell. And I think the more socially acceptable it's going to be, because people won't look odd or different. They'll truly look better. And I don't think there's many people who don't want to look better,
Sure.
There are study after studies that show the attractive child gets better grades. Why? Because the attractive child gets more attention. You don't need to be attractive to be successful. You don't need to be attractive to be happy. But at the same time, there's nothing wrong with feeling good how you look.
Yeah, absolutely. Dr. Denk, well said. And I appreciate you sharing that, because it's definitely one of those conversation topics that is, I believe, important to have for any person considering this, just the amount of depth and scope you have as far as your experience goes for preparing people for all of the different types of expectations and the results.
Well, I mean, a patient's trust is at the end of the day is the only thing I have.
Yes.
And that, I cannot ever take lightly.
Absolutely. Dr. Denk, thank you so much for your time. We'd love to roll out the red carpet for you. Please share this camera here. Any final words or messages that you want to leave the audience with? The floor is all yours.
Well, I'm blessed to work in a field that, I love. And plastic surgery is an awesome career for me. And again, plastic surgery, as I said earlier, is only for the patient. And if you can do something to help your self-esteem, it's going to help your life and at least 10 or 15 people around you lives if you're happy and your back is straight and you're proud. Thank you so much for having me, Joe. It was just a pleasure.
Thanks for being on the show.